Good afternoon, everyone. PAS Lead is pleased to introduce our first speaker for our second annual RSJ conference. Dr. Jessica Tabb graduated with a Master of Physician Assistant Studies from Eastern Virginia Medical School in 2015. Since then, Dr. Tabb has been practicing in psychiatric and addiction medicine. She is currently a reviewer for the Opioid Response Network, an organization that provides education to combat the opioid crisis in Virginia. Most recently, Dr. Tabb has co-authored a book titled ADHD and My PA to bring awareness to the neurodivergent population and care for mental health should be normalized. PAS Lead is pleased to present Dr. Tabb.
There we go. Hello, everyone. Thank you for that lovely introduction. I am so excited to be here with you guys. Excited that this conference and this organization exists, and excited to one day call you guys my colleagues and future healthcare leaders. And I think that this topic is very timely, and it's very important, you know, through schooling and after schooling in your whole profession. So I'm going to try to share my screen here so we can get started. Let's see here. This is my first time doing a Zoom conference, so bear with me. I got my fan going, so I might have a little Beyonce action going with my hair here, but here we go. All right, from the beginning. So my presentation is titled, What is Burnout? So my objectives for this presentation, of course, is to define burnout. It's also to be able to recognize the signs of burnout in ourselves or maybe in others. And then how does burnout relate to other mental health illnesses, and how it can mimic it or maybe exacerbate it. Okay. All right, I hope I didn't lose you guys there. Okay. All right, so when I was in PA school, of course, we always had to understand what was normal first before we could understand what was abnormal. So what is a healthy, normal mentality? This definition was from the World Health Organization, and it states, being mentally healthy is a state of a well-being in which an individual realizes his or her own potential, can cope with normal stressors of life, and can work productively and fruitfully, and is able to make a contribution to their community. So being mentally healthy isn't, toxic positivity. Normal people have negative emotions, just like anyone else, but it's being able to identify those negative emotions and then able to cope with them and continue to be fruitful and productive. So next, let's look at the definition of burnout. And this definition comes from ICD-11. And burnout is a syndrome that is resulting from chronic workplace stress that has not been successfully managed. And it's characterized by three different dimensions. First is the feeling of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. I wanted to point out burnout is not necessarily a mental health diagnosis, but it is included as a reason for people to contact mental health services. Now let's look deeper into those three signs of burnout. So the first sign is exhaustion. This is where people feel drained and emotionally exhausted. They're unable to cope, tired and down, and don't have enough energy. Physical symptoms include things like gastrointestinal issues, stomach or bowel problems. I wanted to remind you that physical and mental health are related. They're connected, they're not separate. Okay, so many times in the field, you'll see people presenting with issues with anxiety or depression, and they might present as GERD or IBS or non-specific stomach pain. They might truly have GERD, but it will be exacerbated by issues with exhaustion and anxiety and mental health. Next, we have alienation from work-related activities. So people who have burnout find their jobs increasingly stressful and frustrating. They may start being cynical about their working conditions and their colleagues. And at the same time, they may increasingly distance themselves emotionally and start feeling numb about their work. Understand that cynicism leads to desensitization. We lose the passion for care and become numb to others' pain, which you can see as a hindrance if we're going to work in medicine. And then we have reduced performance. Burnout mainly affects everyday tasks at work, at home, or when caring for family members. People with burnout are very negative about their tasks and find it hard to concentrate, are listless, and lack creativity. So we become negative about our work, we bring that negativity home, and as we know, nothing positive can come from a negative mind state. So it affects everything in your life. I wanted to look closer at cynicism in healthcare because that can be a very big problem. And there was a study done with medical students, residents, and practicing physicians. And they were analyzing their discussion forums and they were engaged about discourse about cynicism. And they noticed that cynicism was actually used as a coping mechanism for stress. And we can see how that can be problematic. It kind of developed in the challenging work environments due to factors such as limited support, hierarchical demands, and long work hours that we see in our training. And then also they use it as a mechanism when they found it challenging of initiating change due to the tolerance of unprofessionalism and the highly stressful nature of medicine. On rotations, or when you get to rotations, or when you were working in medicine before you went to PA school, you might have heard symptom or statements like patients with these type of insurances are clueless about their health care, or patients in this area of town are non-compliant. Please understand that these statements make us less empathetic, and that can also lead to bias and lead to disparities in healthcare. I want to look at this research done by Dr. Herbert Freudenberger. He was a psychologist who studied burnout, and he found kind of there's 12 phases in the burnout syndrome. So I wanted to go through those. So the first one is the compulsion to prove oneself. So this is us. We have worked hard, got into PA school, we're ready. We're ready to change the world. We're ready to work in medicine, help everyone, and show why we, out of everyone else, because you know it's competitive getting to PA school, we're accepted, right? And then we get into the working harder phase. So you were accepted, and maybe, you know, through undergrad and through high school, we were straight A students. We can balance being straight A students and having other activities and family and other responsibilities. But we're finding that in PA school, it's a little bit harder. You know, it is very true about what they say about PA school. It is definitely like trying to get a drink of water through a fire hose. It is very difficult. So we kind of set that expectation of, I am a straight A student and I can balance all these other expectations, but we're finding that a little difficult to do through PA school. So what we then find is people start neglecting their needs. Okay, so this is where we start neglecting self-care and relationships to study. You know, before we might like to meal prep, take walks and do exercises. Now we're starting to skip doctor's appointments, don't have time to exercise, don't have time to meet with friends and family as we did regularly because we've got to study, we have to focus. Next, we have displacement of conflicts. So that's when we're kind of becoming aware that something's off, but we can't really decipher what it is. We know that we've been a little bit more irritable lately. People are starting to get on our nerves a little bit more. We're more in a negative mind space. We're not sure why this is happening. After that, we have revision of values, okay? And we start denial of physical needs. And our energy is mostly allotted to studying and schoolwork. We become emotionally blunted and we don't have time for hobbies anymore or our friends. You know, people start inviting us out. We don't have time, we need to study. Okay, maybe I had a hobby of gardening. It's gone out the window. We need to focus on studying and that is our main concern. So next after that, we have the denial of the emerging problem. We're becoming intolerant. We no longer care to socialize, you know? We start making rationalizations of why even go to that family function, okay? I can use that time for studying, that's what needs to happen. And then people are just gonna ask me about school. I don't wanna talk about school. I'm just not gonna go. And we see that then leads to the 7th phase, which is withdrawal. We begin to isolate. And for some, they might start using drugs or alcohol to release from the stress of schoolwork and the whole situation. You know, we kind of worked so hard to get to PA school because we saw PA as the fruition of what our purpose is. And now we're working towards it. It's difficult, it's hard. We got to find a way to de-stress. And sometimes we find ways that are not very, very helpful. Next is obvious behavioral changes. And that's when family and classmates and others in your immediate social circle cannot overlook your behavioral changes. They know something's wrong, they know something's off, you are not yourself. And then that can lead to phase 9, which is depersonalization. You no longer see yourself or others as having value. We can start having more negative mind spaces as, I'm just one medical provider, I can't really make a difference. No one cares about their health. None of these teachers can help me. I'm just more in a negative mind space. Nothing is more of value anymore, which of course can lead to inner emptiness. Where there was motivation and compassion and empathy is now emptiness, okay? And then we might start trying to fill that emptiness with exaggerated activities such as overeating, sex, shopping, or other activities that temporarily increase our dopamine. That can then lead to a state of depression, where we feel exhausted, hopeless, indifferent, and then feel our life has no meaning, which then leads to that final phase of the burnout syndrome. We collapse physically and emotionally. Some might start having some issues with suicidality. This is where we definitely need medical attention. And for some, they see that or start contemplating that suicide is the only way to escape what we're feeling. I wanted to talk about clinical depression because there are a lot of symptoms of burnout that can also apply to depression. So I want us to be able to differentiate the two. This is a definition from the DSM-5 on clinical depression. So again, this is feelings of sadness, low mood, and loss of interest in your usual activities, and must mark a change from previous level of functioning and have persisted for at least 2 weeks. So as we talked about before, depression and burnout both have extreme exhaustion as a symptom and feeling down and reduced performance. But some unique symptoms more to depression is low self-esteem, hopelessness, and more chronic suicidal tendencies. So if you're seeing those symptoms, they're not really specific to burnout and more in line with depression. So people with burnout don't always have depression, but burnout may increase the risk of someone getting depression. We don't want to jump to a diagnosis of just burnout because the treatment for burnout works very well for burnout, but we know treatment for depression is a little bit more complex. I wanted to talk about also some suicidality factors that we need to keep in mind if we start getting into that burnout and depression mode, because they're very unique to us in the healthcare fields. So from research in general, those that have committed suicide and succeeded in this country, over half of them did not have a psychiatric illness diagnosis. I wanted you guys to keep that in mind because as a healthcare provider, a lot of times we feel, even if we see these symptoms, that I can manage this myself. You know, I'm smart enough, I can take care of this myself. I don't need to seek help. Or the stigma about, seeking mental health. It could be societal, it could be cultural. We want to keep that in mind. And take our mental health as important, and keep that as important as our physical health. Stress is a very important factor that comes into place with mental health and suicidality. And let's keep in mind that many of you were working in health before you got to PA student, or came to PA school and became a PA student. So you were working in this pandemic with the overburdened healthcare systems. That was a very stressful time, and it's still going on. And now you're in PA school, which is very, very stressful. I am so happy to be a PA. I love being a PA. I do not want to do PA school over. It was very stressful, okay? So your feelings are very valid. So keep in mind your level of stress. And then also, healthcare professionals have a higher likelihood of experiencing problems with their jobs and physical health compared to the general population. So we're already on a higher alert than the general population. So you want to keep that in mind. And then lastly, when we look at suicidality and we look at those who contemplate suicide, and those who decide a more violent means of suicide. A lot of those that choose those means had some sort of desensitization to those means. They've been in prior traumatic environments. They've seen other people hurt themselves or cut themselves. They've seen violent situations. Us in the healthcare field are desensitized to death a lot of times because we have to see it. We're around it all the time. We talk about it. It's a part of our training. And when it comes to things like piercing yourself with a sharp object, that again is part of our training. So we are a little bit more desensitized to things like that. So just want to keep that in mind. Of course, our training is not leading to more suicidality, but if you are in that headspace, if you were, are in a depressive mind state or leading to that place in burnout, you want to keep that in mind. I also wanted to talk about this. I got this from the Commonwealth Fund organization page where they look at global health trends. And these are the suicide rates in all the developed countries in this nation or in this world. And as we see, even though United States, we spend the most money on healthcare and we have the lowest life expectancy, we are also #1 in suicide, okay? No, now more research needs to be done on this because we're not exactly sure why we are #1. And you know that suicidality is very complex. It could be quality of care, access to care, different aspects of our culture. But one theorized point we wanted to bring out is we are also the only country of the developed nations who do not have mandatory time off. We are the only ones. So it is very imperative that we look at ourselves and how we're treating ourselves and making sure that we're not having actions that lead to burnout. I thought another important part of this discussion, since we talked about feeling emptiness with alcohol and trying to cope with stress, is to not forget about alcohol abuse and alcohol dependence. I know when I was in PA school, we like to, celebrate. Let's celebrate this, the end of the rotation exam. We passed the cardiology module, let's have fun, let's let loose. We've been studying all day. Let's have a drink. And there's nothing wrong with enjoying yourself and socializing. But just think about yourself and your habits now. And let's remind ourselves, according to the National Institute of Alcohol Abuse and Alcoholism, drinking is considered to be moderate to low for a woman to have 3 drinks in one day or 7 drinks in a week. And for men, it's 4 drinks in one day and no more than 14 drinks in a week. So just ponder your own, own habits there and look at that. So, working in mental health, I see a lot of patients who, it's more socially acceptable to get a drink than it is to seek mental health. So people are more apt to go get a drink, and they tell me, I'm okay. I do drink, to relax, but I don't have withdrawal symptoms, so I'm okay. Let's not forget alcohol abuse, and that's drinking too much too often, and that also includes binge drinking. And we want to understand: are we using just having a drink to socialize, or are we using that as our mode to de-stress? Are we using that as a pattern to de-stress? Because that can be very dangerous, lead to other health issues. And it also can lead to dependence. And that's when we have increased tolerance. Before I could, feel a buzz after 3 drinks, now I need 4 or 5. And now we are seeing some of the withdrawal symptoms. When I stop drinking, I can't sleep. I can't think of another way to unwind. That's when things become dangerous. And we all know that that's definitely a pattern we don't want to get into. Drinking is so socially acceptable. And in the beginning, it works good. It works well. We get relaxed, we feel good, but we all know nothing good from using drinking as your only modality to de-stress. Nothing good will come from that. And all the other issues that come from becoming alcohol dependent. So again, let's just summarize these consequences of burnout. We'll have issues with relationships, breakdown of family connections and friendships, and loss of important emotional support that we need to function. We're in a negative mind state, we're isolating, family doesn't want to be around us. We're not connecting with people as we should. And isn't that the purpose of life, is to connect with people? And now you're not doing that, so we want to be mindful of that. Of course, occupational consequences. Burnout is related to loss of growth in the healthcare profession you envisioned and worked so hard to get into. You have loss of creativity, motivation, and ability to do less because you have less focus. You can experience absenteeism because you're calling out from work a lot, or what we call presenteeism, where you're coming to work with no motivation, unproductive. So, you're losing productivity. You know, you work so hard to get here to this point, let's not lose it all by burning ourselves out. Burnout can also lead to issues with physical health. Burnout is associated with weakened immune systems. This leaves us more open to different viral issues like the flu. Burnout is also associated with hyperlipidemia, type 2 diabetes, and other cardiovascular issues. It is shown that those who develop burnout are twice as likely to suffer from chronic musculoskeletal pain than those without burnout. And as we all know, these comorbidities can significantly decrease our quality of life. As we talked about earlier, burnout can lead to issues with our mental health, or if we already know we have issues with trauma or bipolar disorder or depression, it can exacerbate those issues. And because of all those comorbidities we just mentioned, they can lead to an end of life earlier than we want it to be, or if we get to the point of suicidality, us unaliving ourselves. So in conclusion, burnout is a phenomena that we've seen an increase in the medical profession. The three main characteristics of burnout are exhaustion, alienation, and reduced performance. Burnout can lead to or exacerbate mental and physical conditions, which in turn can lead to an early death. If you yourself are experiencing burnout or any mental health issues, I want you to reach out. I want you to reach out to faculty, family, your PCP, seek a mental health provider. And just wanted to leave that brand new suicide line. I'm not sure if everyone's aware of 988. You can definitely call it and seek help. I just wanted to end on one of my favorite quotes from Hippocrates, which is, wherever the art of medicine is loved, there is also a love of humanity. Thank you very much. And those are my references.
Thank you, Dr. Tabb. And we are going to open it up to any questions that anyone may have. You can put them in the chat. We have some chat moderators, or you can raise your hand and I will call on you. I think the first person we have is Deepthi.
Oh, I was just applauding.
Oh, thank you.
Thank you so much, Dr. Tabb. It was a very insightful presentation, and I'm sure everybody had benefited a lot from your presentation. Thank you.
Thank you. Thank you guys for having me.
I have a question. Hi, my name's Fallon. I'm a first year PA student at Towson University. As you were talking about the importance of mandatory leave and things of that nature, what are your thoughts on mandatory counseling for employees, especially for those who are in high critical areas like trauma and ER and things of that nature? Just having administrators see that as an important aspect to avoid the burnout, to improve the quality of care for patients.
I personally think that counseling and therapy is useful in everybody's life, truthfully, because being able to cope with stress is something we all have to learn. No one's born knowing how to cope with stress. And because of all the work we do to help other people's lives, we have to make sure that we are whole. I know you guys have all heard that saying that you can't pour from an empty cup. So I think when we are accepting job offers, I think it's important to talk about time off and how accessible it is to use time off. I've had a few colleagues who took positions where they said you get a certain amount of time off, but then later learned that trying to take the time off was met with, well, are you going to make this time up? Or they gave them a hard time. You definitely want to work in an environment where they value your mental health as well as the care that you provide to their patients. So I think it's really important. And I think as society starts valuing mental health more and more, we're going to see that as a standard in the healthcare field.
I see we have a question from Liz.
Good morning. Hi, Dr. Tabb. Thank you so much. This was such a great way to kick off the conference. And it was just so informative. And I've definitely gone through all of those stages that you have mentioned. So I just wanted to say thank you for being here today and for sharing all of this with us. This was such a great way to start off the conference. Thank you so much.
No problem at all. Thank you guys for having me.
Sonia?
Hi, I just wanted to say thank you as well. One of the PAS lead directors. Another thing is I'm super grateful that you brought up the alcohol abuse. My therapist actually in didactic year said that I don't know whether you or your classmates actually realize it or not, but you're on your way to becoming alcoholics, because it was getting to the point where every Friday and Saturday night, that was the plan. We're going to go out, we're going to get drinks. And it was the waking up hungover. And the only reason we thought we were functioning was because we were able to study the next day. So I really appreciate you bringing that up, because I know not a lot of people discuss that.
Yes, definitely. I remember being in PA school, and one of my classmates said to me, he was like, do you think we're functioning alcoholics? Because hey, you know, we study hard, then we want to go out and enjoy ourselves. And I think it's just good to be mindful of, are we using that modality as a way to de-stress and not slipping into addiction? But definitely don't mean to not go out and have a nice time. You can have a glass of wine, but make sure that we don't see that that's the only way we have to de-stress. And I think that's where people get in trouble. And I see that with patients a lot.
Victoria?
Hi, Dr. Tabb. So I just kind of had a question more so about like so far in rotations, I have seen certain individuals in the office that I can tell are burning out. For example, as a student, definitely I see it as like a challenge to really address that, because I'm kind of in and out of this office. I'm there for 4 weeks and then I'm gone. But just I kind of like want to know going forward, how would you recommend navigating if we see besides in ourselves, but if we see a coworker that we can kind of tell they're starting to burn out, all the signs that you went through, how would you navigate that conversation, either with them, with like the office manager? Like, how would you kind of try to get them help without being like overbearing, I guess, you know what I mean? And it's really, I think, challenging. Like we had a provider in an office that I'm currently in that I could tell was burning out the very first 2 weeks I was at the rotation. And then as it kept going, HR kind of got involved because they started yelling at, some of the other providers, some of the other nurses. And this was something that I was like, everybody was kind of upset about, but I was like, hey, like I could tell that this person was really struggling. So not to validate that they were yelling at people by any means, but I could tell like if we had stepped in, if someone in the office had like stepped in and done something, maybe in the beginning, maybe it wouldn't have gotten to the point where they started yelling at, the nurses, other providers, things like that. Like the conflict would have maybe been reduced. So I guess like as a learning experience for me, I kind of wanted to like figure out in the future in an office that I work for, how should I have done that? Like, how would you have recommended that go?
And that's definitely a slippery slope. Because even when it comes to mental health, the person themselves have to realize that they have a problem. So I think that one thing you can do if you feel comfortable with talking to them is even showing them some of their actions. Like, I can see you're frustrated. It seems like you're frustrated a lot. And maybe say, I know when I'm feeling frustrated or when I feel almost burnt out, I do X, Y, Z, just to get them thinking about it, because they really have to come to that that realization to themselves. And a lot of times that might work, that might not work. But a lot of times the consequences of their actions get them to understand that they are burnt out. So sometimes you bringing it up can be, she doesn't understand she doesn't have my issue. She doesn't have my problem. She doesn't understand what's going on. She doesn't understand my stress. So I would try not to make it accusatory, but more of, man, I can understand, some patients can be really stressful when they're non-compliant. It can almost make me feel burned out, but I know that sometimes I have to go de-stress, take some time off, or make sure I'm taking care of myself, just leaving those kind of jewels and those hints around, and maybe they might hear you. Sometimes there are things that we as ourselves can't remedy unless we are in administration, because then we don't want to become the person they then isolate themselves from, because you're too much of a mirror to what's going on.
Thank you.
No problem. Yes, is that it for me today?
Hi, sorry, I can't figure out how to raise my hand for some reason. But I guess I wanted to thank you for being here. This was like a really cool presentation. We've had in my school, we've talked a lot about like burnout, I think, and I really like the discussions that you brought up, like things about like functional alcoholism. That was really cool. And like cultural barriers. I just wanted to talk a little bit more about like the patients and patients being non-compliant and how to approach that. That can always be a little difficult. I know just because of the culture that I come from, sometimes mental health is very like taboo. I mean, I'm very lucky, I feel, because my support system is really good about that. But I know that I have relatives and family friends that definitely have had a lot of a hard time with mental health, and bringing that up in their family setting, in their support system, just because it's so like not okay to talk about.
Mhm.
So it's really cool that we can talk about that, especially like I like this in this environment where we are a diverse group of people, where we're talking about the experiences we've had. So that was really cool. I was wondering if you had like any tactics that you maybe used to try and understand maybe your patients when they weren't being compliant, to try to understand where they were coming from or their culture. If you had any experiences or stories of how that helped you get to a patient.
Definitely. And because I come from a culture too, where mental health is, it's not real. People just need to suck it up. It's about willpower. Just think happy thoughts and everything's wonderful. It's like, oh, well, obviously, how many uncles that I have that are alcoholics. I mean, nobody just drinks to drink. Okay. A lot of times I talk about my own experiences so we can kind of connect on that level, and then try to talk about the symptoms that I might see them going through. It's just like, why sometimes we just feel irritable, right? You can't even pinpoint why you're irritable. It's like, why are you so irritable? I don't know. So everybody's getting on my nerves, and then they can connect like, yeah, I felt that way. And it's just like, bring them also to the realization you don't have to feel that way. And we can try different treatments, but also sometimes it's just leaving that pearl of information that they think about. And sometimes they might not take my recommendations the first time, but I might see them a month or two down the road, because especially with mental health, when you're not getting treatment, it's just going to get worse. So I know it's not just something that's going to go away. And I think a lot of people think that it is something that's just going to go away, especially with depression. They think there's a destination that things are better. When I just get that new job, or when my kid is no longer a toddler, or when my husband is not on deployment, he's home, or I'll be happy. And they realize that when those things come, they're not happy. So a lot of times they do end up coming back to me, and they'll say, remember when you were talking about XYZ, I see that now. And when people see it, they're more apt to start taking my recommendations. So it's really good to connect with the patient, because then they feel safe with you and feel safe with talking about and opening up about things they probably haven't talked to anybody else about. So, and that's why I love my job. But, yeah.
Thank you. No, that's really useful. I think I definitely might try to use that in the future. That's very interesting.
Hello. Yeah, I was trying to find the hand raise function as well, but I couldn't. But yeah, so I wanted to say that I really appreciate your talk as well. I work at a neurology clinic, and with that, the parents have a lot of power over their children's health. And I know recently, my neurologist suggests that they should take their child to the psychiatrist, and they was not happy with that at all. And they said, we took our child here for a neurology problem. Like, they're unacceptable. Like, I guess they don't see the mental problem as a health problem. So they totally turned that down, and they did not take that advice, and they just walked out. So yeah, I just wanted to point that out. So
we see that a lot. It's interesting from the different positions I've held in psychiatry. When I worked in rehabilitation centers or assisted livings, I walk into patients' rooms, and a lot of times these patients don't have a lot of visitors. So when anybody walks in the room, they're happy. They're like, yes, somebody to talk to. And then I introduce myself and I say with psych, and they're like, oh no, I'm not talking to you anymore. Because there's so much of a stigma of, I'm here to judge you, and you're crazy if you talk to me. And it's just like, well, if you have a brain, you have mental health. Okay, period, point blank. Okay. I'm just here to talk to you. I worked with a clinic where it was mainly primary care, and then they decided to have me there on site to help with any mental health problems. And it was interesting because some of the primary care providers would refer them to me and not tell the patient why I'm there. So they would come in and I'd say, I'd start asking questions, and like some would just stop and be like, wait, are you a shrink? oh no, and just get up and leave. Like, no,
Yeah.
I can't do this, no. So it's about breaking those barriers. It's about normalizing care. It's about understanding that mental health is just as important as physical health. It doesn't mean if you talk to me, I'm going to send you away in a straitjacket and you're going to be institutionalized. And really, those people have to just start becoming more comfortable. We might not be able to get them that time, but if we start normalizing care, opening up to them, making them feel more comfortable, they might start coming around. But also, healthcare providers, we need to reflect the community, that's out there. So I'm so glad that there's going to be more diverse healthcare providers. People feel more comfortable because you can share that cultural connection with them, and they trust you more. They feel that you care more. And I truly do care. And I think that's really important as well. And even if you decide to go into primary care or neurology or wherever else, still talk to of course, about mental health. And then the more that they trust you, if you decide to send them to a mental health provider, they're more apt to follow that recommendation because they trust you who recommended it. So they might just need to trust their provider more and just open up. But sometimes, like you're saying, it's hard. It could be culturally stigma-wise, like, oh no, are you saying my child is crazy? Like, what are you saying? I'm not doing that. But the more you work with them and the more they see that their issue is not being resolved, they'll be more open to care.
Thank you.
Trying to look at that chat. Any other questions?
Yep, I'm checking the chat as well.
Thank you for presenting today.
Right, thank you guys so much. Thank you for having me. It's been wonderful.
Thank you, Dr. Tabb. We truly appreciate you presenting today. Our next speaker will be starting at 12 p.m. So we are going to be taking a approximately 5-10 minute break. We'll be posting stuff in the chat and answering any questions.